harness the ingenuity of our scientists and the resourcefulness of our people. And we have to help the world to drive coordinated global strategy, not shut ourselves off from the world. Protecting the health and safety of the American people is the most important job of any president. And unfortunately, this virus laid bare the severe shortcomings of the current administration. Public fears are being compounded by pervasive lack of trust in this president, fueled by adversarial relationships with the truth that he continues to have. Our government's ability to respond effectively has been undermined by hollowing out our agencies and disparagement of science. And our ability to drive a global response is dramatically undercut by the damage Trump has done to our credibility and our relationships around the world. We have to get to work immediately to dig ourselves out of this hole. And that's why today I'm releasing a plan to combat and overcome the coronavirus. The full details of the plan, want to see them, go to joebiden.com, where I lay out the immediate steps we have to take to deliver one, decisive public health response to curb the spread of the disease and to provide treatment to those who need it, and a decisive economic response that delivers real relief to American workers, families, and small businesses, and protects the economy as a whole. I offer it as a roadmap, not for what I will do as president 10 months from now, but for the leadership that I believe is needed and required at this very moment. President Trump is welcome to adopt all of it today. The core principle is simple. Public health professionals must be the ones making our public health decisions and communicating with the American people. Public health professionals. It would be a step toward reclaiming public trust and confidence in the United States government as well, towards stopping the fear and chaos that can overtake communities faster than this pandemic can overtake them. And it's critical to mounting an effective national response that will save lives, protect our frontline health workers, slow the spread of the virus. First, anyone who needs to be tested based on medical guidance should be tested at no charge. At no charge. The administration's failure on testing is colossal, and it's a failure of planning, leadership, and execution. The White House should measure and report each and every day, how many tests have been ordered, how many tests have been completed, and how many have tested positive. By next week, the number of tests should be in the millions, not the thousands. We should make every person in a nursing home available for testing. Every senior center or vulnerable population has to have easy access to the test. And we should establish hundreds of mobile testing sites, at least 10 per state, and drive-through testing centers to speed testing and protect the health of our workers. The CDC, private labs, universities, and manufacturers should be working lockstep to get this done and get it done correctly. No effort should be spared, none. No excuses should be made. Tests should be available to all who need them. And the government should stop at nothing to make that happen. We must know the true extent of this outbreak so we can map it, trace it, and contain it. Nor should we hide the true number of infections in hope of protecting political interest or the stock market. The markets will respond to strong, steady, and capable leadership that addresses the root of the problem, not efforts to cover it up. Secondly, we need to surge our capacity to both prevent and treat the coronavirus and prepare our hospitals to deal with this influx of those needing care, as I've been saying for weeks. This means not just getting out the testing kits and processing them quickly, but making sure communities have the hospital beds available, the staff, the medical supplies, the personal protective equipment necessary to treat the patients. The President should order FEMA to prepare the capacity with local authorities to establish temporary hospitals with hundreds of beds in short notice. The Department of Defense should be planning now, should have been planning, to prepare for the potential deployment of the resources provided, medical facility capacity and logistic support that only they can do. And a week from now, a month from now, we could need an instant 500-bed hospital to isolate and treat patients in any city in this country. We can do that, but we are not ready yet, and the clock is ticking. As we take these steps, state, federal, and local authorities need to ensure that there's accurate, up-to-date information available to every American citizen, to everyone, so everyone can make an informed decision about when to get tested, when to self-quarantine, when to seek medical treatment. And the federal government should provide states and municipalities with clear guidance about when to trigger more aggressive mitigation policies, such as closing schools. Thirdly, we need to accelerate the development and treatment of a vaccine. Science takes time. And it will still be many months before we have a vaccine that can be proven safe for public use and produced in sufficient quantities to make a difference. But therapeutics can and should come sooner. This will save lives. When I put together and we passed the Cures Act of 2016 to accelerate work on at the National Institute of Health, but now it has to be made